Hi everyone, my name is AJ. I am the online learning specialist here at Child Australia. I'm super excited. I have my friend Natini here today. Natini is a oral health therapist and she works with Dental on Wheels, which is a pretty exciting business, coming out to early learning services and working with families out there. So Natini, hi. What made you want to start a business that's working so closely with the early learning services?
Well, this takes me back to my journey as a mum.
Yeah.
12, 13 years ago, I had my firstborn son and started to work in dentistry, starting from being a dental nurse, and I worked my way up. And my own experience raising my son, basically I had to go through a lot of searching and trying to find information as a mum, which is really hard. There's not much information in early learning for children who may have some behavioural issues and things like that, because my son was displaying all these behaviours, and over time a lot of people have been pointing fingers at maybe he's got ADHD, maybe he's on the spectrum, or autism even. And with myself having been a single mum for so long, I naturally thought that maybe it was my fault, maybe because I didn't spend enough time trying to read to him or doing things with him. So yeah, that's why I wanted to spread the knowledge and making sure that, because early learning and educators spend the most time with the children, and they would be the first one to pick up if something's wrong with your child.
Yeah, absolutely. And as a parent myself that's been working in the sector for so long, I think that recognition of lack of information and not having that access, especially around oral health and hygiene, it's so important, and we do forget how much of a role it plays in our growth, our development, as we do put so much into literacy and numeracy, which is it is so important. But then also, like you said, it's all connected, which is, I know I'm learning a lot from working with you as well, which is brilliant. So Natini, you go out to services and you've recognised that it's hard as working parents to get those dental checks, which are so important. What do you do? So when you go out to a service, how do you do what you do?
So when I do go out to services, I first, before I go out, I send out videos, introduction to say, hello, my name's Natini and my friend Chompy here. We're coming to the daycare centre and we're going to do some toothbrushing fun. So then we start with the activity with the kids, so raising awareness how to brush your teeth, how many times, and eating healthy foods and drinking water and milk. Yeah, so we do a lot of fun stuff with the children. Sometimes we dance, sometimes we sing songs, and then after, I do check-up and screening, so we do oral health assessments. So my assessment is different from other people because I realised that in my uni years, we never taught about the connection between oral health and airways and sleep. And this is something that unless you are interested in it, or unless you stumble across it like I did with my own son, you're never going to find out. Unless you specifically study sleep medicine, then that's another pathway that some of the dentists would lean towards, but not all dentists or dental professionals are aware of the airways connection.
Wow. And it's something that when children might present with behaviours that might be challenging, or parents might come to us as educators and go, have you noticed this? This is a little bit, we're not sure what to do. Quite often it's been, okay, maybe get them into their GP or an ENT, throat referral or something. But I think having access to dental checkups or screenings before things are even noticed, does that mean that you can actually pick up on some of this stuff, or potentially see that there might be something?
Yes, definitely. Wow. Even before a baby has a teeth, you can actually see the shape of the palate, which is the roof of your mouth. You can see how the jaws are sitting, or if the lips are open, that means they're mouth breathing, so they're not actually breathing through the nose. So we have to investigate on, why are they doing it? Why are they not closing their mouth? So,
Oh my goodness, there's so much. There is so much, and that's why you have done what you do, which is brilliant, which is exciting. So it does help us when we're working with smaller children and their families. I think sometimes it's that we are that support to families if they're not sure if something's happening, but also we can bring that knowledge to them as well, which is great that you do have that support too. So Chompy, tell us a little bit about our friend Chompy. Super cute.
Comes to me to every visit, and he also stars in all my videos.
Yes.
We do fix a few of his teeth because he doesn't brush very well. So
Oh, no.
yes, they get a bit of germs, and we have to fix them.
Yeah, no, that's fair. And I think that's something too, is that you like working with the littlies and you value that importance, which is something that, you know, aligns with us at Child Australia. It's that getting that information and that access of information nice and early too, which is beautiful.
Definitely, and the kids
Nice.
love it. They often want to take turn holding him.
Brilliant.
And some do get scared though, because he can be a little bit intimidating with all his 32
He
teeth.
does 32 teeth. So 32 teeth, is that how many adults have? Or is,
Yes.
okay,
Including
cool.
your wisdom. So
Wow. So Natini, being an oral health therapist, there must be times where you're working with educators and the families where there's some of those aha moments, and I think of sleeping as one. You've mentioned sleeping in our conversations before, where if there's a child that, you know, might wake up a lot during their nap times, whereas at home, you know, it might be happening as well. But as educators, we might think, you know, they're just settling or what have you. There's actually a relationship, isn't there, between
Yeah.
sleep patterns, and oral health and hygiene.
yeah, definitely.
What are some of those things that you sort of, especially in the early years spaces, that you do tend to find that families and educators are like, oh my gosh, didn't even think of it?
So if the child's restless in bed, basically they're not having a restful sleep, they're not having, what do you call it, like a deep sleep
Yes.
kind of state. So they get disturbed, that's why, or they can't breathe or things like that, that's why they keep waking up. So waking up multiple times a night, you might not see that during the day a lot, but during the day you might notice that if the child's sleeping with the mouth open or even lips apart,
Yeah.
not completely sealed. That's also them breathing through the mouth rather than the nose. You could hear them grind sometimes. Some children, like my son, grinds chronically. It's
Yeah.
so loud, you can hear, and
Wow.
it's like a nail on the chalkboard.
Yeah.
Yeah, so those are some signs that they're compensating for the airways, basically.
Okay.
Yeah.
And that's, you know, you don't even think of that.
Yeah.
And I think that's something that's, as educators, we are in that position to potentially see these things
Yeah.
maybe before families, depending on, or
Yeah.
it might be something that, you know, the families are just like, oh, but that's normal. So
Yeah, I've
Yeah.
been told as well. That's why I started this too, because my son was grinding a lot. He opened his mouth when he breathes, and every time I asked the dentist that I worked with in the past, any oral health, any dental professionals that I spoke to, they said to me that it's normal, that he'll grow out of it, but he never did.
yeah.
Yeah.
Oh, one to look out for sure.
Yes.
Yeah.
Yeah.
And so the open mouth as well
Yeah.
while sleeping. I can imagine that, especially if they're smaller babies or younger toddlers, that they might have a pacifier or a dummy.
Definitely. That's
Is that
another-
something that you can still recognise the
Yes.
open mouth if they've got a
Yes.
dummy or a pacifier? And
Yes, or thumb sucking, or
Yeah.
any objects at all that they put in their mouth. So that would cause the teeth misalignment. When the pacifier has been in the teeth for a long time, it pushes everything up. So you get what we call open bite, where the teeth doesn't collapse together. You
Yeah.
get a little space in the middle.
wow,
Yeah.
does that
That
fix
shapes-
itself? Does it rectify itself?
No, not unless you stop it. We do recommend, well, the ADA has recommended the pacifier use is only up to 6 months, really.
Yeah. Yeah.
Yeah, anything that continue on is more of a comfort thing.
Yep.
So you want to try and encourage them and switch it out for maybe, a mouthing toys rather, so that they can
So they can still get that oral sensation.
yeah,
that
sensory. They can try and put things in their mouth a little
Yeah.
further back so that they don't get the gag reflex and things like that. That will help with
Yeah.
speech as well as sensory to food.
Wow,
Yeah.
there is so much. There is so much. What are some of your top tips or recommendations that educators can do in their services to help support families and little ones with their oral hygiene?
Yes, so there's a few things that you can do as an educator. If you have, for example, we'll start with babies. Even though they don't have any teeth, you still need to clean out the mouth because you don't want residue from the milk that has bacteria and things in it
Yeah.
to actually affect their gums and their oral health. So what you can do is use a damp cloth, but make sure that you use boiled water.
Yeah.
So you don't want to introduce any harmful bacteria for babies who have no immune system.
Yeah.
Squeeze it out and just have a little wipe around.
amazing.
After the feet.
Yeah, you don't even think
Yeah.
of that. So yeah, tip number one, cleaning baby's mouth even when they don't have teeth.
Yes.
Love it.
Yeah.
What would you say, there's also some that I've seen where people have recommended against, it might not necessarily happen in services as much, but that mouth onto baby's face or baby's head
Yes,
contact, especially when, you know, they've got these delicious heads that you just want to give a kiss to.
Yes.
What would you recommend in that?
We recommend maybe they can avoid kissing the baby, especially newborn, on the lips, because if an adult have cold sores,
Yeah.
they can pass that on to the child.
Yeah.
And when you're a baby, you're a newborn, you will take that, and it can be quite fatal for the baby.
Wow. Yeah.
Yeah, so kiss the feet instead, maybe.
Kiss the feet. I like
Yes.
that. Kiss the feet. And so what are some other tips that I know pacifiers, dummies, this is something that we come across a lot in services.
Yes.
We know the research says it's about 6 months to start weaning or to try and start weaning.
Yes.
But as we know, they are a comfort item as well.
are.
So is that one of your recommendations as well, to
Yes.
ditch
So,
the dummy?
Yes, definitely. 6 months is what the recommendation is, because past beyond that is when they don't actually need it. It's just for comfort.
Yeah.
And if you leave it for a long time, it's also a lot harder for you to try and take it away from when, you know, they have tantrum at 2 and terrible 2s and 3. That's what they
Yeah.
say. So it'd be a lot harder to wean it off when they're older.
Yeah, so supporting families
yeah.
sooner
Yeah.
than later.
So what you can do at the daycare centre is you can limit the amount of time. So you
Yeah.
can say, look, you only allow pacifier when you go to sleep. So when you're in class, you can play with other toys. You can put that back in the bag.
So open the word of pacifiers
Yes,
to us.
I brought a few to show you from home. Now these dummies are really cute, and I see a lot of
Yeah.
parents love them, especially with the pastel colors or blue and pink, things like
Yeah.
that. They're quite big and round. We call them cherry-shaped dummy. Now these one are really bad for your teeth and your palate as well because they're so big and they stays in there. Imagine if you stay in there all night. How many hours do babies sleep?
Yeah.
Or not continuously, but still.
Yeah, yeah.
8 to 9 or 10 or 12 hours even, it stays in there. So it's shaping the teeth and the mouth. You want to avoid that. And these ones are cute and fun, isn't
Yeah,
it?
I see those gimmicky ones a lot,
Yes,
yep.
but let's just stick with this one for just picture taking and things like that, but not use it all the time because they're also, even though it's got a flat slant, it's still quite bulky and round on the
Yeah.
top. Yeah. So you want to look for something more thin and flat like this one.
Yep.
So I know there's a lot on the market, and it does advertise that it's orthodontic dummies. There's no such thing.
Okay.
There are some that are designed by dentists and orthodontists, but none of them would guarantee that it doesn't interfere with the teeth.
Yes.
That's why we recommend that you wean them off at the age of 6 months.
Yep, fabulous.
Oh, and one more thing,
Yes.
sorry, that I see out there at the
Yeah.
center as well is when you attach something to the dummy, to like a chain.
Yes.
If it's heavy or like a toy, the weight that it pulls, it also kind of pull your teeth out. So you end up
Yeah.
with the
Yep.
protruding teeth.
Yeah, absolutely.
so-
So if we were supporting families, they are going through that journey of removing dummy. Can you do things like swap up if they're currently using the cherry one, can you swap the dummy up for something that might be a little bit more flatter, like you've seen there, and that
Yeah,
can start that
yes.
sort of ditch the dummy progression?
Yeah.
Or, I mean, of course, you can just completely remove it.
Yeah.
It can
Or
be a
you
bit
can limit
hard.
the time on how much you use.
Time limits.
Yeah.
Beautiful.
So,
If you were to give a parent, educator, 3 tips on when it's time to ditch the dummy, we want to encourage it from 6 months, but when the time is right, what would be your top 3 things that you say, this is some great ways that can help? You've given us one that's, limit the time and the usage.
Yeah.
Yeah.
small dummy and flat, so switch out
Small
to
and
that
flat.
one, limit the time, and also I guess you can try if the child is, by the age of 3, you really want it gone.
Yes.
But I still walk around, daycare centers seeing, 3 or 4-year-olds still having a dummy. But by that age, I think they understand enough that you can negotiate with them. So
Yes.
offering rewards is a good one. So
Yeah.
you can switch out. Let's say if you give away the dummy back to the tooth fairies,
Yeah.
then she will grant you, I don't know, a Barbie doll or something like that.
Yep.
Or a toy car.
Yeah, that's a great idea. So working with the families, if you know that a family is going through the process of ditching the dummy, then being aware of the support systems that they're putting in place. If it is a reward chart, implement that as well in your service, or help
Yeah.
with that positive reinforcement and that
Exactly.
encouragement, so that that little one, because you said that from 6 months it becomes a comfort thing. So
Yes.
we're taking away that comfort, so to speak. So we want to do it nicely. We want to be
Positively.
gentle with it,
Yeah.
and we want it to be a great experience.
Yeah, and you know what I used to do when I was working at a dental clinic? I offered a reward.
That's a
I
great
made
idea.
like a little advertisement, and I offered a reward for found dummies.
Ooh.
So if the child or the parents can't get rid of it themselves, sometimes they come to me and say, "We found a dummy. We'd like you to take it." Because
Yeah.
we'd like to collect the reward. So I would give them a toy.
That is
in
such a
return.
good idea.
So maybe daycare centres can do that as well.
yeah, having like a reward system, then
Yeah.
donating old ones. I think
Yes.
that's fabulous. Of course, they won't be reused in the real world, but
But before you do that, you've got to really talk to them and
Yeah.
make sure that they understand once they give up, you can't go back, because if
Yeah.
you do the yo-yo effect, it doesn't work.
yeah.
So you have to
and-
stick with it.
And that's something that, especially if you're working with children that are currently going through this process, is that
Yes.
consistency. What's happening at home, you want to have happen in your service as well. It's the only way that it's
Yeah.
going to actually
Yeah.
really work. Great idea. And what about in terms of teething? We come across teething babies, of course. It's not comfortable. I can't imagine that it's comfortable.
Yes.
What would be some recommendations around teething? Because you see so many different things. Sometimes parents will bring us teething gels to use, and we fill out medication forms. With anything, make sure you're following your policies and procedures as well.
Yes, definitely.
But in terms of supporting teething, what are some of those recommendations that we can do easily?
Yeah. Best thing is ice rings, icy poles even, if they're allowed. Preferably no
Yeah.
sugar.
Yeah.
But yes, anything cool that would help soothe the gum and irritation. They like to chew on things as well sometimes. It doesn't
Yeah.
have to be ice rings. You can use chew toys and things like that.
Yeah.
Because it's itchy and it's annoying, so they just like to rub the gum against something.
Yeah, absolutely. And I like
And,
that the ice ring or the ice toys,
Yeah,
because I mean we can make those as well,
yeah. And if they really want settle for sleep, then you use your Panadol and Nurofen,
Yep.
depending on the age, and follow instructions. But I try to not to use too much unless you really
Yeah.
have to.
Oh, awesome.
And Bonjela, which is another one, your teething gel.
Yeah.
They are good for soothing, but they do contain alcohol, so you have
Okay.
to be mindful how much you use and how often you use.
Yeah, and I think that's with anything with, when families are bringing in products to us, especially things like teething gels, that, making sure, again, policies, procedures are followed,
Yeah.
but just double checking the usage as well as how long in between usage and things. It's a medication
Yeah.
at the end of the day too. So awesome. And dental checkups. This is something that I know is your jam. You go in, you do the dental checkups. When, how often, what's the deal with dental checkups?
Well, you can go as soon as the first tooth arrives.
Yeah.
That's not only checking for the tooth is arriving on time, or if it's delayed, for any other issues that might occur in the mouth that we can see. If the baby's latching and not, you would be talking to your lactation consultant. They may see that you have a tongue tie. But if the baby is tongue tied and still functioning, the lactation consultant may not refer you to have it
Okay.
released. From dental and airways point of view, we can see that if it does affect how they breathe, then it may need to be released. So yeah, that's the
Oh,
check. So it's not just the checking teeth; it's
Yeah.
overall, and yeah.
It's the whole child. It's the whole mouth, the whole thing. Oh, awesome. So what does a breathing disorder look like, especially in the early years? So we're sort of thinking babies, but maybe even when we're thinking our kindy children, sort of that 3 to 5 age group, what might a breathing disorder look like?
Yeah, so if a child of that age around have breathing disorder, so you imagine when you sleep and you're not actually sleeping, you get disturbed sleep throughout the night, you're not getting enough oxygen to your brain, you can't function properly when you wake up. So you see children that are tired or wired during the day, or really hard to wake up in the morning and they get tired during the day all the time, or you get temper tantrums and meltdowns, and I'm not talking just your normal child behavior meltdown, it's a lot of outbursts, almost to quite an extreme, and the behavior can come across as aggressive as well.
Yeah.
Yeah.
Sometimes there's that correlation. I sort of think of where there's neurodivergencies at play as well, is that sometimes we really want to gain understanding and support the child. So we might quickly go, oh, maybe we need to encourage the families to look at neurodivergency. But
Yeah.
maybe it's also looking at that first port of call being there.
Yeah, because even if
Airways.
the child has neurodivergency or ADHD, if they're not sleeping properly, or anyone really, if you're not sleeping properly, you can't function. You know, your brain fog all the time, and you're tired, and you're irritable, and yeah. So sleep, just rule it out first thing, and then if that still doesn't work, then we know what to do next.
Yeah, and I guess as an adult, when we get a stuffy nose or when we can't sleep properly, we're irritated, we're
Yes.
upset, we're uncomfortable, we're not great the next day, we're
Coffee
probably
all the time.
exactly, we're caffeinated, and
Yes.
so yeah, I can just imagine that if, and parent myself, but wanting to find that understanding as an educator to support that child when you go, I know there's something else there.
Yeah.
I think it's fabulous knowing that there are dental screenings and oral health screenings that can support that, which is really, really interesting.
Yeah. But you have to, when you do seek out airway screening, that make sure that you ask or your dentist or your oral health therapist or myofunctional therapist who are actually airways aware.
Ah, Airways
Yes.
Aware.
So
Tell
not
me
everybody does that.
more. Okay, so Airways Aware, is that, what, that sounds like something from the oral therapist perspective. I've not heard of it before. Tell me.
So, like I mentioned before, that in my education, it's not included in our university training to do the airways. And on the average, really, of dentistry, even the dental students, that they spend on studying sleep study, it's between 4 to 6 hours in the 6 years of their studies.
Wow.
So unless they're specialised in sleep study, they're not doing this and they're not aware of it. So there's no connection between the airways and breathing and oral health.
Oh, fabulous.
Yes.
And that's something that you do in all of your screenings, that you do
Yes.
an airway check?
Yes,
Yeah.
I offer that to the families.
What happens at the end? So when you come into our services, you're supporting, and if families choose to do a oral health screening, what happens if you find something, or what are the next steps that you might suggest?
Yeah, so when I come out and do oral health assessments, I do airway screening as well as your dental screening to see if they have decay and things like that. So if they have decay, I send them off to a dentist or pediatrics or oral health therapist, and they can address the decay issues. They can fix them with fillings and things. And if I find airway issues, which means it involves asking a lot of questions to the parents and carers, such as yourself. How are the child sleeping? How are they? Do they have anything like a dummy or pacifier, or do they thumb suck? And then I see what's inside the oral cavity, and I married that up with all of these questions and signs and symptoms.
Yeah.
When I do find it, then I refer them to your airway aware dentist. What they can do is, for example, if a child has a high palate, which means the roof of your mouth, and that's the nasal floor. So if the arch is high, that means the airways is also narrow. So they might need a palate expansion. So rather than waiting for your traditional orthodontist that doesn't start until you're 12,
Yeah.
you can do palate expansion for as young as 4 years of age.
Wow.
Yeah.
Oh, awesome.
And once the airway is widened, so you get the better airflow, and then the child can breathe better.
Yeah,
and sleep better.
fabulous. So one might be that referral to an airway aware dentist.
Yeah.
What other referrals might you have?
Could be referred to your ears, nose and throat specialist. So if I find that tonsils are large, we grade them from 0 to 4, 0 being completely removed and 4 being touching in the middle of your uvula, so your hanging bits.
Yeah.
So if that's large and the mouth is not big enough and the airway is not big enough to accommodate that, they may need to go see ENT, and your ENT might decide that they might remove some of it, or they might wait and see. That's for them to decide.
Yep.
Yeah, but that would help with the airways.
Absolutely.
Yeah.
Yep. So
Dentist.
airway aware
Yes.
dentist, a ear, nose and throat specialist.
Yep.
What else?
Also, myofunctional therapist.
That's a fun word.
Yes.
What does
yes,
that mean?
So I like to, this is how I like to explain to parents what myofunctional therapist is, or myofunctional therapy. It's a little bit like a physio for your mouth.
Oh, cool.
So, you got to exercise, you've got muscles that move your jaws and your neck and things like that.
Yep.
So you've got to exercise them, because if you're not exercising or you're not using them all the time, especially the airways, it's collapsible.
Oh,
So
wow.
if you're not using all this muscle, or if the tongue is not sitting in the right position, then it rolls back and it collapses and block the airways.
Wow. That makes me think about, even some of our educators and, working in the sector, that we clench a lot, and you know, maybe we need to be doing this mouth physio too. So.
Yeah.
Yeah, oh, awesome. You've given us so many great tips. If you've enjoyed these tips, make sure you check out our socials, our Facebook, Instagram, connect with Dental on Wheels, and come see us for more.